Hi, Jack. Hi, everyone. Welcome back to Speakeasy English. Today, we are talking about visiting the doctor, describing a problem, and following simple medical advice.
Hi, Emma. Hi, everyone. I am ready. Visiting the doctor can be stressful, but we will make it easy and clear today.
Perfect. Let us start with an easy question. How do you feel today, Jack?
I do not feel great, Emma. I have had a sore throat and a cough for 2 days, and I feel a little tired.
Okay, that is a common problem. We will show useful sentences you can use at the clinic or over the phone. Remember to repeat after us. If you like this episode, please like the video and subscribe to our channel.
Yes, I will like and subscribe right now. Thanks, Emma.
Great. Let us begin. First, how to make an appointment by phone. Practice this phrase with me. Say, "Hello, I would like to make an appointment with the doctor, please."
Hello. I would like to make an appointment with the doctor, please.
Good. Another way is, "I have a sore throat and a cough. Do you have any availability today?"
I have a sore throat and a cough. Do you have any availability today?
Excellent. Now, imagine you're at the clinic desk. The receptionist asks for your name and date of birth. You can say, "My name is Jack Brown, and my date of birth is January 5th, 1990.
My name is Jack Brown, and my date of birth is January 5th, 1990.
Very clear. Now, the nurse or doctor will ask, "What is your main problem today?" Practice saying, "My main problem is a sore throat. I also have a cough and a slight fever."
My main problem is a sore throat. I also have a cough and a slight fever.
Nice! Use short sentences and simple words. If they ask, "How long have you had these symptoms?" say, "I have had these symptoms for 2 days."
I have had these symptoms for 2 days.
Good. The doctor may ask about pain level. A natural way to say it is, "On a scale from 1 to 10, my throat pain is about a 4.
On a scale from 1 to 10, my throat pain is about a 4.
Perfect. Now, let us practice answering a few more questions the doctor might ask. First, do you have any allergies? You can say, "No, I do not have any allergies."
No, I do not have any allergies.
Next, are you taking any medications? Say, "Yes, I take vitamin D every morning." Or, "No, I am not taking any medications."
No, I am not taking any medications.
Very good. The doctor may also ask about recent travel or contact with sick people. Practice, "I have not traveled recently, and I have not been in close contact with anyone who is sick."
I have not traveled recently, and I have not been in close contact with anyone who is sick.
Nice. Now, imagine the doctor listens to your chest and throat. They might say, "Open your mouth and say, 'ah.'" You can say, "ah."
Ah.
Good, that was natural. The doctor might check your temperature and say, "You have a low fever." You can ask, "What does low fever mean?" And the doctor can say, "A low fever is around 37.8 to 38.5 degrees Celsius."
Okay, that is clear.
Now, let us talk about common, simple advice the doctor might give. The doctor could say, "Rest at home, drink warm fluids, and take over-the-counter pain relievers like acetaminophen or ibuprofen." You can repeat, "I will rest, drink warm fluids, and take acetaminophen if needed."
I will rest, drink warm fluids, and take acetaminophen if needed.
Great. If the doctor prescribes medicine, you could ask, "How often should I take this medicine?" Or, "Are there any side effects I should watch?" Practice, "How often should I take this medicine, and are there any side effects?"
How often should I take this medicine, and are there any side effects?
Excellent. Now, another useful sentence is to ask about work or school. You can say, "Do I need to stay home from work?" Or, "How long should I stay home?"
Do I need to stay home from work? How long should I stay home?
Perfect. Short and clear. Now, a few common phrases for the pharmacy. If the doctor writes a prescription, you can say, "Thank you, I will go to the pharmacy now." Or ask, "Where is the nearest pharmacy?"
Thank you. I will go to the pharmacy now. Where is the nearest pharmacy?
Good. The pharmacist may ask, "Do you have any allergies?" Again, you can say, "No, I do not have any allergies." And the pharmacist will tell you how to take the medicine. Take 1 tablet every 8 hours with food. You can repeat, take 1 tablet every 8 hours with food.
Take 1 tablet every 8 hours with food.
Nice. Now we will add a small practice section for listeners. Repeat after us slowly. "Excuse me, I need to see a doctor."
Excuse me, I need to see a doctor.
"Can I make an appointment for today, please?"
Can I make an appointment for today, please?
"My throat hurts and I have a cough."
My throat hurts and I have a cough.
Those are very useful practice lines. Repeat them a few times and try them out loud. And if you find this helpful, please like the video and subscribe to Speak Easy English.
Yes, I already like and subscribe. Great idea.
Okay, let us continue. Sometimes the doctor will ask about other symptoms like a runny nose, headache, or body aches. Practice saying, "I also have a runny nose and a mild headache."
I also have a runny nose and a mild headache.
Good. The doctor might advise a throat lozenge or warm salt water gargle. You can say, "How often should I gargle with warm salt water?" And the doctor might say, "Gargle 3 times a day." Practice asking, "How often should I gargle with warm salt water?"
How often should I gargle with warm salt water?
Gargle 3 times a day. Good. Now, if the doctor wants to check for strep throat, they might do a rapid test. You can ask, "Is this test painful?" And the doctor could say, "It is quick and it hurts a little, but not much." You can repeat, "Is this test painful?"
Is this test painful?
Haha, that is a good question. People often worry. The test is quick. If it is positive, the doctor may prescribe antibiotics. You can say, "If it is positive, what medicine will I take?"
If it is positive, what medicine will I take?
The doctor might say, "You will take antibiotics for 5 to 10 days, depending on the infection." You can repeat, "I will take antibiotics for 5 to 10 days if needed."
I will take antibiotics for 5 to 10 days if needed.
Now, let us talk about when to go to the emergency room. The doctor will tell you to go to the ER if you have trouble breathing, severe chest pain, or a very high fever. You can ask, "What signs mean I should go to the ER?" And the doctor might say, "If you have trouble breathing, persistent chest pain, or a fever over 39 degrees Celsius, go to the emergency room immediately."
What signs mean I should go to the ER?
Good question. That is important to know. Use simple words like trouble breathing and severe chest pain. Now we will practice telling a doctor about your pain location. Say, "My throat hurts when I swallow."
My throat hurts when I swallow.
Excellent. Or if you have pain in the chest area, say, "I have chest pain right here." Pointing is okay in person, but say the words too. Practice, "I have chest pain right here."
I have chest pain right here.
Nice work. Now, a common situation. The doctor wants to give you self-care tips. They might say, "Rest, stay hydrated, avoid smoking, and use lozenges." You can repeat, "I will rest, drink fluids, avoid smoking, and use lozenges."
I will rest, drink fluids, avoid smoking, and use lozenges.
Perfect. Let us add a quick role play. I will be the doctor and you be the patient. I will ask a few questions and you answer. Ready?
Ready, Emma. Go ahead.
Do you have a sore throat or a cough?
I have a sore throat and a cough for 2 days.
Do you have a fever?
I have a slight fever yesterday and today.
Any allergies?
No allergies.
Any recent travel or close contact with a sick person?
No recent travel and no close contact with a sick person.
I will check your throat and temperature. Please open your mouth and say ah. Thank you. The test is negative for strep, but you have a viral infection. I recommend rest and fluids. Do you understand?
Yes, I understand. Thank you.
Good. The doctor may say, if your symptoms get worse or you have difficulty breathing, return to the clinic. You can practice saying, I will return to the clinic if my symptoms get worse or I have difficulty breathing.
I will return to the clinic if my symptoms get worse or I have difficulty breathing.
Excellent. Now a short section about useful vocabulary. Repeat the word and meaning with me. First word, check in. Check in means to register at a desk when you arrive at a clinic or airport. Check in. Check in.
Check in.
Check in. Good. Next word, prescription. Prescription means a doctor writes a note for medicine that you take from the pharmacy. Prescription. Prescription.
Prescription. Prescription.
Nice. Next, over-the-counter. Over-the-counter means medicine you can buy without a prescription. Over-the-counter. Over-the-counter.
Over the counter. Over the counter.
Perfect. Keep practicing these words. Now one more practice set. Repeat after us slowly. Excuse me, I need to see a doctor.
Excuse me, I need to see a doctor.
Do I need to stay home from work?
Do I need to stay home from work?
Where is the pharmacy?
Where is the pharmacy?
Those practice lines are great. If you are enjoying this lesson, please like the video and subscribe to Speak Easy English and share it with a friend who is learning English.
Yes, I will like and subscribe, and I will share it with a friend.
Thank you, Jack. That helps a lot. Now a few tips for the listener. Drink warm liquids like tea with honey, use a humidifier, and get plenty of rest. If you have a chronic condition, talk to your regular doctor first. Those are helpful tips. Also remember to tell the doctor your full medical history if you have other conditions like asthma or diabetes. That information helps the doctor give the best advice. Practice saying, I have asthma and I take an inhaler.
I have asthma, and I take an inhaler.
Good. Now a quick, fun question, Jack. Have you ever been very sick while traveling?
Yes, one time I had a stomach problem while on a trip. I had to find a clinic in a different city. It was stressful, but I learned how to ask for help in English.
That is a useful story. People learn from mistakes and small scares, right? Now, before we finish, one last short practice. Repeat, can you recommend a medicine for a cough, please?
Can you recommend a medicine for a cough, please?
And how long will it take to get better?
How long will it take to get better?
Wonderful. Keep practicing those sentences. If you have a sentence you want us to practice, leave it in the comments and we will use it in a future episode.
I will comment a sentence now. Thanks, Emma.
Thank you everyone for listening to Speak Easy English. Today we talked about visiting the doctor and following simple medical advice. Remember, short, clear sentences and practicing out loud will help you speak with confidence.
Thanks, Emma. This was very helpful. I will practice these lines and I will like and subscribe right now.
Bye for now, and remember to keep practicing your English with small, real conversations. See you next time.
Goodbye, everyone, and take care.